Hello. Hello, class. My name is Sydney Jordan, a fellow veteran and an advocate for mental health illnesses. Music therapy shows theoretical and empirical evidence that promotes healing for active duty military and veterans, which should be 100% covered by health insurance. The practice of music therapy has shown theoretical and empirical evidence that promotes and facilitates healing among active duty service members and veterans with trauma exposure and PTSD, as well as a tool for addressing its symptoms. As part of treatment and management of PTSD, music therapy is considered as an alternative self-management technique in addition to psychotherapy, medication, and non-traditional therapies such as service animals. Its applications date back to 1945 when the U.S. War Department issued Technical Bulletin 187 detailing a program on the use of music for reconditioning among service members convalescing in Army hospitals. PTSD is defined as a condition that can develop after exposure to a potentially traumatic event that is beyond a typical stressor. Military personnel are at risk for developing PTSD caused by combat exposure. It is essential to understand the role and contribution of music therapy on clinical outcomes as a complementary and integrative treatment to address this condition. The white paper titled U.S. Military Music Therapy and Technology by music therapist Hope Young status report in 2014 that recommended the use of music in the VA's rehabilitation program to address pain management and for social, emotional, and behavioral health, and has shown significant results. It cited intervention which include but are not limited to instrument lessons, lyric analysis, composition, improvisation, relaxation, guided imagery, and music-oriented coping skills. One study of veterans with PTSD, which reports a 22 decrease in overall PTSD symptoms as measured by the Post-Traumatic Stress Disorder Checklist Civilian PCL-TAC-C scale, as well as a 28% reduction in depression symptoms. On top of that, health-related quality of life, as measured by the ERO-QOL, improved by 21%, and self-reported cognitive difficulties decreased by 13%. These outcomes were observed after 6 weeks of intervention. Similar studies also shown an increase in self-regulation, decreased anxiety and panic, and decreased dissertations. According to the white paper, these studies are positive outcome measures achieved through music therapy. The music therapy's use in the VA, which enables the government's push to increase total wellness care initiative for veterans. There is a growing demand for board-certified music therapy clinicians utilizing music therapy services for America's service members, veterans, and their families. A study notes that music therapy carries less stigma as a therapeutic option for treating post-traumatic stress compared to other evidence-based interventions such as trauma-focused cognitive behavioral therapy, cognitive processing therapy, eye movement desensitization, and reprocessing therapy, and prolonged exposure, which are time-sensitive, require highly specialized and lengthy clinical training and supervision, and have been associated with high levels of attrition. It is important to note that researching music-based interventions designed to inform evidence-based music therapy interventions for service members and families is an integral part of a collaboratory, interdisciplinary, and cross-disciplinary approach to support this undertaking and is not used in isolation. Several empirical studies show that employing music therapy to address PTSD and its symptoms have yielded the following outcomes. 1. Improved feelings of self-worth and reduction of isolation using group drumming therapy. Number 2. Significant reduction of post-traumatic stress symptoms using CBT alone or CBT with additional 10 weeks of music therapy. 3. Improved sleep quality and reduced anxiety symptoms after 5 days of group therapy with music and progressive relaxation script for half of the participants. Number 4. There was a reduction in anxiety within group. No change in depression or social relationship satisfaction after applying music therapy for half the participants. The variable length of treatment. A pilot study supported by the Health Services Research and Development under the U.S. Department of Veterans Affairs assessed the effectiveness of music therapy on relieving PTSD symptoms, specifically through a 6-week guitar training program under the direction of seasoned instructors through a partnership with Guitars for Vets. It produced remarkably positive results with additional findings suggesting that music therapy was effective in reducing depression symptoms and improving health-related quality of life. The program has since been successfully taken up by several VA locations, including the Hampton, Virginia VA Medical Center. The American Music Therapy Association, AMTA, published a white paper in 2014 that explores the profession of music therapy, focusing on active duty service members and veterans. In cities, the case of Marine Corps veteran Thad Holloway and Army Corps veteran Michael Slayton, who met through the music therapy program at the Hines VA in Chicago, Illinois, and have been singing together for 20 years as part of a group. Slayton, the military veteran, recounted working with someone who was instrumental in their recovery and rehabilitation through music. He quotes, "It was one music therapist who saved my life, Jessie Herndon, who would come up to my room twice a week, and I would cuss her out and call her every name, and she knew I would call her names, and argue before she even got up there. But she kept pushing me, and she never gave up. She wanted me to try singing before she even heard me sing a note." Fellow Chicago veteran overcame PTSD through music therapy. Air Force veteran Chris Smith says healthcare helped him deal with the anxiety of losing his eyesight. "Through singing and playing the drums, stress is the first thing I notice that disappears. PTSD is always there. Anxiety is always there. But I know when I play, my anxiety is significantly less. It's helped me be more considerate of other people. We're all in this together. We're all mindful of each other." Music therapy's 70-year history in the U.S. military covers the entire continuum of care among service members, veterans, and their families. It is a vital part of treatment currently delivered in military treatment facilities and VA medical centers across the country, delivered by board-certified music therapists. The AMTA notes that more music therapy and credentialed music therapists are needed to keep pace with current needs of military populations.